This is MakerGalaxy.
We're always talking about the future of design, the future of technology, the future of making. In a world where smart skin patches can administer specific medications on a set schedule, a world where personal farms can be built into kitchens, how do we find the next big thing? MakerGalaxy is a show that explores the crossroads of design, technology, and the future of making. Welcome to the show, everybody. I'm your host, Simon Martin, and this week we talked with Mr. Randy Schwemmin of the nonprofit product design firm DRev. DRev aims to create medical equipment for populations that make less than $4 a day, and Randy's extensive background in manufacturing helps make this seemingly impossible task possible. We'll talk with Randy about everything from how he went from working in the aerospace industry creating million-dollar products to creating products made for millions making less than $4 a day. We'll also talk about how DRev approaches their design process as a nonprofit to where we can find the best ice cream sundae on earth and more. Today's episode is brought to you by the new Objet 500 Connects 3 from Stratasys, the world's only color and multi-material 3D printer. Offering incomparably brilliant and consistent colors, plus transparent colors, the Objet 500 Connects 3 lets you create the most true-to-life modeling possible. Find out more at stratasys.com. Welcome, Randy. First, we want to know, where can we find the best ice cream shop on earth, and what should we get there?
So my favorite is Swenson's Ice Cream in Ann Arbor. There are a couple of different locations, but anything with their chocolate recipe at Swenson's is amazing, and they have the best hot fudge, so make sure that that's part of the ice cream sundae you order.
That sounds really good. So now, last week we had Linnell Cameron of the Autodesk Foundation on to talk about impact design, which is something that you are no doubt passionate about. But before we get into DRev and the impact design you guys are doing, could you tell us a little bit about who you are, Randy, and your background?
Sure. So my current role at DRev is the Director of Technical Operations, and that means that I'm responsible for everything related to our products. From need finding through product development, manufacturing transfer, launch, scaling, sales, distribution, after-sales service, all the product-related activities, which sounds like a lot, but we're an 11-person organization, so we're small and have a lot of...
We're
doing a lot of work with with very few people. So before I came to DRev, I've been working in the manufacturing and supply chain industry for quite a while. I'd been at Genentech, which is a biotechnology large pharma company, before doing supply chain work, and then before that worked in the defense industry and the medical device industry in manufacturing and supply chain roles. In the middle, I went to graduate school at Stanford University and did an MBA and master's in manufacturing, and then my undergrad was from the University of Michigan in aerospace engineering.
And so that's how you know about that excellent sounding ice cream shop.
Exactly.
So, okay, that's an incredible background, and it's really interesting that you went from developing products that are millions of dollars to produce to developing products for people who live on less than $4 a day. So what is DRev exactly, and what do you guys do?
So we are a product company. We, like you mentioned, focus on selecting problems and then designing the products to meet the problem's needs that either improve the health or increase the income of people that live on less than $4 a day. So we're focusing on very high-need markets, and we're always keeping the user in mind and designing products that are both world-class and that we want to only provide solutions and products to the patients and the users that meet the same standards that people in rich countries would expect, but we also want to do it in an affordable way that makes it possible for low-resource patients and low-resource hospitals and users and customers willing and able to purchase our products because they're affordable enough and attractive enough to spend their hard-earned cash to purchase and to use. So we put two kind of big pressures on ourselves. One is to meet the world-class standards for treatment, therapy, and quality, and then also to make it affordable and attractive so that it can be purchased on the market and use market principles to scale its availability to the places that need it the most.
And so what are some of these projects specifically? Sure.
So we have two main programs. The first is our neonatal jaundice program and our product called Brilliance, which is an LED-based phototherapy device that treats newborns that have jaundice. And before we entered the market, the available products in many of these countries were either fluorescent tube-based or they were LEDs, but they were very expensive, around $4,000 a unit. And our Brilliance LED unit retails for around $400 in India.
Wow.
The second product is the Remotion Knee, which is a highly effective and affordable prosthetic knee joint. It's the part of the prosthetic leg system that's the most expensive and complicated to make and manufacture and to buy. So we've taken some of the features of a world-class sort of polycentric geometric design and adapted it to be very affordable. So we're targeting the Remotion Knee to sell for $80, and its kind of closest competitor in this kind of in the same geometry with the same functionality is over $1,000.
Wow. And so these people making less than $4 a day, they pay for these products at $80, or is there some sort of program that gets it to them cheaper?
Well, that's a great question. So our model is that we don't want to rely on donations to support our product sales. We want to make sure that we are providing a product that the market can afford, and that also that all of our partners in the supply chain are going to continue to make a profit on it after we're done investing in product development. So we basically raise money because we're also a nonprofit. I didn't mention that earlier, but we're a product company, but we are technically a 501c3 nonprofit in the U.S. So we raise money to pay for product development and then invest in getting the product to the point where it's commercialized. And then once it's commercialized, we choose partners that are going to make and sell it at a profit. So they need to be able to make money on it in order to have the incentive to keep making it and selling it after we're done investing in product development. So with the knee, for instance, at the $80 price point, it'll still be made and sold at sufficient margins to motivate our partners to keep making and selling it worldwide. However, in most cases, the patients who are getting treatment for amputations are going to free clinics or to ministries of health or health centers that are giving away care. But we want to make sure that our knee is competitive with all the other knees on the market that those centers would be buying with their own money. So we're not going to be donating knees to patients. We're going to be selling knees to clinics, but the clinics are, for the most part, then raising their own money to buy the components they need and do the treatment protocols they need in order to fit amputees.
Gotcha.
So the amputee usually doesn't pay out of pocket, or if they do, it's a really nominal fee that probably doesn't cover the costs. But our model is to sell to the clinics that then are turning around and using their own infrastructure and their own fundraising or however they're funded to then treat the patients they want to see.
With literally thousands of unsolved design problems in this market, I mean, how do you guys even go about researching and finding these problems, and then what makes one issue more important than another?
So we hear about problems from our users, and one of the things that we are really passionate about is making sure that the problem is real and that it's a problem statement that has high enough need to work on. So we have a sort of internal rule of thumb to work on problems where we think that we can impact at least 1 million lives.
Wow.
And so that sort of rules out localized solutions or kind of niche products. And for instance, the yearly unmet need for treating children with jaundice is around 3 million patients. So there are a lot of patients that need, it's 7 million patients, take that back. Jaundice is 7 million patients, the knee is 3 million amputees a year. I get them kind of mixed up. But the yearly unmet need for treating babies with jaundice is around 7 million patients. So we know that there's a substantial need for that that's going unmet today. And that gives us the kind of confidence that the product that we developed to solve that problem is going to have impact. We learned about the need for phototherapy from a doctor who approached one of our staff at a conference. They were at the conference kind of looking at other things, and the doctor said, "Oh, you don't need to work on that. What we really need is sheet phototherapy because it's very simple technology and it's very, very effective. It's just not available. So if you could adapt the idea of using LEDs to make phototherapy affordable, it would make a huge difference and revolutionize jaundice therapy in developing markets." With the knee example, we are actually partnered with and absorbed a student team from Stanford University that was approached by a clinic in India that needed a better technology than their single-axis knee. It's the largest fitter of prosthetic limbs in India called the Jaipur Foot Organization. They approached the Stanford class and said, "Our knee is not performing like we'd like it to. We know that a polycentric knee, we've heard, is a better design. Can you adapt a polycentric knee geometry to fit with our prosthetic leg system?" And then the Stanford class developed the first version of what's now the Remotion knee, and we've been adapting it since then to make it commercializable, if that's a word, to get it ready for commercialization.
Very interesting. And so, in terms of getting to the bottom of these design problems, how do you and your team approach the research process? I mean, do you guys go live with these communities for a period of time, or how do you immerse yourselves into their world?
So we do spend a lot of time with our users. We don't always live with them for extended periods, but we've had staff go into the field and stay with sales engineers or stay even with patient families to get exposure to how the patients are living day to day. For the most part, though, our need finding really is richly done, or we get a lot of rich information for our need finding from the clinics and the doctors. So the people that are treating the patients are the ones that have the best insight for us in many cases on what does and doesn't work and what the patients are able to, are willing to accept or need the most. So we spend a lot of time with clinicians. And some of the clinicians are doctors that were dropping in. So in the case of the knee, there are clinics where prosthetists from the U.S. or from Europe will basically collect or buy components in their home market, and then they'll fly to Guatemala or Nicaragua or Sub-Saharan Africa and do a whole bunch of fittings at once and then fly home. So that kind of drop-in clinic model is helpful for us because it's easier for us to reach and talk to the doctors who speak English and are in the U.S. in the same time zone, but then have a lot of personal interaction with the patients. Other times, though, we spend days in ICU units in India watching how neonatal care works, talking to nurses, even through translators sometimes, figuring out how the phototherapy market works and what does and doesn't work for treating a newborn with jaundice, but that also might have hypothermia problems or have respiratory issues or have sepsis. Like, all those things are kind of part of the package of a newborn who's in trouble, and we need to make sure that our device works in the environment that also kind of sees a whole bunch of other complications involved with premature, malnourished, and otherwise challenged newborns.
Interesting. And so, in a way, the doctors themselves are, in essence, to some degree or another, the product designers themselves, and you guys are you're the enabler. You're taking these crude concepts and polishing them and making it a shipped product. So have you ever had a doctor just kind of plunk a crudely made prototype on your desk and say, how do we make this for 1 million people?
Yeah, we get that a lot. Some are better than others, but yeah, we do get that a lot. And it's exciting because they're passionate about what they want to achieve, and they really, really care about serving and helping the patients. So when that happens, we like to give them as much of positive but also kind of useful feedback as we can to encourage them. And sometimes the ideas are really interesting, and we have follow-up conversations and see if they're willing to license it or where it might go. The other thing that's interesting is that the need for phototherapy, for instance, is so stark that we've gone to a lot of hospitals where they couldn't afford to buy a commercial product, and they made one themselves. So industrious biomedical engineers in the hospital will figure out how to make a fluorescent tube light fixture that fits over the top of a crib, and they'll put as bright of lights as they can find into the top of the fixture in order to treat the baby. It's not as effective as blue light, but it's better than nothing. And or sometimes they even try to find the right blue light tubes to go in the unit. But the kind of makeshift, homemade, we'll make it work attitude is it's also kind of neat because again, it's just demonstrates how much people care about trying to treat the patients that really need help, but are only able to make do with what they have on hand.
Definitely. So have you ever had a case where maybe your product is better or good enough where hospitals in the Western world have said, we're just going to run with this concept that these guys made because it's not $4,000, it's $400, and it works just as well? Has that ever happened? So
we do get inquiries for the knee from people in the U.S. saying, I'd like to buy your knee, and we're not ready actually to sell it commercially, so we tell them, well, hang on. But they are asking because they have a really complicated and expensive electromechanical knee, and they don't want to get it wet, or they don't want to take it to the beach. So they'd like to have a spare, and they're willing to have their prosthetist build them up a second leg and put our knee on it because it is durable. You can get it wet, you can get sand in it, and it won't completely fail. And they want something that they can be a little bit more active in than their sort of electromechanical wonder that is very easy to use and to learn to walk on, but is kind of finicky and susceptible to damage.
Definitely. And so with this whole system you guys are working with and bringing these ideas to life, how would you say designing products within a nonprofit might differ from a more traditional design studio? And on the other side, how is it the same?
I think it's actually pretty similar in most cases. So from a day-to-day point of view, we have engineers running CAD, putting products on a load cell machine, making 3D prints, doing engineering release. It's all very similar work to what someone would be doing in any other kind of product development environment. One of the things that's different is that we're always thinking about how to measure the impact of the product. And for us, impact is not sales. So, it's part of the deal, but sales is not the end of the transaction or the end goal. What we want to make sure we do is understand pretty deeply how the product is being used and whether or not it's treating the patients we intended to treat. And for example, in the Brilliance product line, we are trying to increase access to care for patients who would not have access, which means that we are trying to make sure that we're putting all of our marketing and feature development and our targeting for the product towards public hospitals or charity-based hospitals or faith-based hospitals that have a mission to serve low-income patients or to serve patients who it's their last resort. And because of that, we actually measure which hospitals our partner sells to, and we keep track of how many babies we think those devices have treated. So we can estimate how many patients Brilliance has treated who otherwise would not have had access to effective phototherapy. And that's our impact. Our impact is providing access to care, preventing kernicterus or other diseases that result from, or conditions that result from untreated jaundice, and essentially preventing deaths in patients who would have otherwise gone to public hospital and had no phototherapy available or ineffective phototherapy, and would either have required a blood transfusion or suffered horrible complications from the jaundice. So we actually incorporate the data collection features into the product so that we can plug it into a laptop or eventually a smartphone and suck off all the usage data from the microcontroller, and then use that to validate our usage predictions, so that we can tell if the product's being used every day, if it's how many babies it might be treating, what the temperature is in the environment. Those are the types of things that we designed into the product so that we can measure the impact and get an idea of how it's being used.
So in a way, it is basically exactly the same as a traditional product design studio, but instead of a marketing plan and mood boards and styling boards, you're basically replacing that with impact charts and impact data. Interesting.
Yeah, exactly. Now, we still have to have some flavors of industrial design, and because we need to make attractive products.
Oh, totally.
Yeah, what you described is exactly right.
Very interesting. And then you did mention you guys use 3D printers, which is expected as a product design firm. But on that note, with 3D printers dropping in cost, what are your thoughts on educating perhaps more localized communities on the basics of CAD and creating micro factories for them to solve their own problems as they see fit?
It's exciting. I hesitate a little bit to get over ambitious about that with medical devices, because the need, for instance, the materials available today, or even in the sort of nearish future, aren't strong enough to support a patient. And we also worry a little bit about quality control, because because people have asked us, why don't you just open source the knee, make it 3D printable, and let anybody make it in country? And the reason is that we put a lot of engineering work into material selection and into making sure that the stresses are correctly managed. And if someone's not using the same material, or they're using inferior resins, it'll fail, and having the product fail could damage, or it could hurt the patient, or could put them in serious risk. So there is some risk with the medical industry in kind of that crowd-sourced approach, and we want to make sure that risk is manageable before we kind of went gun-ho about supporting it. But for things that aren't that risky, I think it's an exciting thing to follow.
Oh, definitely. That's what Linnell was talking about on our last episode, was how excited she was about these little maker spaces kind of popping up. Yeah, it's definitely exciting. So one last question for you, Randy. What has been your most rewarding experience to date with DRev that might inspire a listener to perhaps take a closer look at getting involved with impact design themselves?
Sure. Great question. For me, the most rewarding thing that I've done is it's a combination of, it's visiting patients. So, and it's either a tie between visiting the Jaipur Foot Clinic and talking to an amputee who's just been fit with our knee and watching them walk, which is amazing, and watching the difference in their walk between when they came in and when they left, because a lot of times if they come in with something, it's a single-axis knee, or it's just a peg leg and it's a locked lower extremity, and they are limping quite heavily, and then when they start walking with a polycentric knee, like the remotion knee, they almost look like they have a natural gait.
Wow. And
watching that's amazing. And then the other part of it is watching babies recover. And I mean, we don't usually watch the same case all the way through when we visit an ICU, but when we talk to the patients and talk to the mothers, usually through translators, they're very happy to be seeing their baby get better, and reversing the effects of jaundice is it's relatively straightforward in Western medicine or in high-resource country hospitals, but it's kind of new and exciting to watch babies recover in markets where in hospitals where they probably weren't recovering before.
Excellent, and hopefully that number keeps growing. But thank you so much for your time today, Randy.
It was my pleasure, Simon. It was nice to meet you, and I had a great time talking to you.
Today's episode was brought to you by the new Objet 500 Connects 3 from Stratasys, the world's only color and multi-material 3D printer. Offering incomparably brilliant and consistent colors, plus transparent colors, the Objet 500 Connects 3 lets you create the most true-to-life modeling possible. Find out more at stratasys.com. Thanks for checking us out today, and if you'd like to find out more about Randy and D-Rev, be sure to check them out over at d-rev.org. On our next episode, we'll be talking with T. Chang, the force behind the upcoming Women in Industrial Design show coming up in San Francisco this June. I'm your host, Simon Martin. Stay tuned and check in with us next week on MakerGalaxy.
A production of EBD Media.